Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. Today on the podcast, I'm joined by our deputy editor, Nick Bostock.
Hiya.
And senior reporter, Kimberley Hackett.
Hi everyone.
To talk about some of the key news stories affecting general practice. Coming up on the podcast today, we're talking about GP contract negotiations after the government confirmed it intended to talk to key stakeholders as well as the BMA as part of putting together next year's deal. And Health and Social Care Secretary Wes Streeting wrote to the profession accusing the GP committee chair of lies and unprofessional behaviour. We're discussing this week's budget and what some of the measures outlined by the government could mean for general practice. And Kimberley will be telling us about an article she wrote recently interviewing a GP who has spent time working in Gaza. Our good news story this week is about patients and a neighbouring surgery rallying around to help a practice that was severely affected by flooding in the wake of the recent Storm Claudia. So first up, we talked on the last news podcast about the England LMC's conference, and following that conference, the government suspended all talks with the BMA. This week, GP leaders raised concerns that general practice is facing yet another contract imposition in April next year, given the breakdown in relations between the BMA and the government. Nick, what's going on here?
This is the time of year when the government, NHS England and the BMA GP committee are usually meeting regularly to discuss changes to the GP contract for the financial year ahead. This current government is particularly keen on shifting away from what's been the status quo over many years, with contracts and pay uplifts being announced well after the start of each financial year. So you'd very much expect that, as we sort of get into December, the process of working up next year's contract changes would be well underway. Of course, things are quite different this year because the BMA and the government are in dispute over changes to online access requirements. And the government is basically refusing to talk to the BMA GP committee while the dispute continues. And it's in that context that we got a line from the government about their approach to developing the contract for next year, for 2026-27. So a spokesman for the Department of Health and Social Care, the DHSC, told us that they would consult with the BMA England GP committee as we usually do, but they would also change their approach to engage with wider primary care stakeholders, including patients. There are some bits of language in that have raised concerns about the level of influence that GP leaders from the BMA, the union representing the profession, will have in shaping this year's contract, and whether the government's approach ultimately will be to impose rather than to try to agree a contract for the year ahead.
The key word in that government statement is consult, isn't it? It says it's going to consult with the BMA rather than negotiate with them. The government is not actually required to negotiate with the BMA on the GP contract, is it? What do the rules and regulations actually say?
There's a bit of nuance here, and reading between the lines, the regulations around GP contracts say the Health and Social Care Secretary can make directions around pay under GP contracts and has a duty to consult any body appearing to the Health and Social Care Secretary to be representative of people whose pay are affected by those decisions, those directions on pay under GP contracts. The regulations also say the government may consult such other persons as it considers appropriate in this process. So the relationship between the BMA GP committee and the government is different from the sort of situation where a union is recognised by an employer as having collective bargaining rights over pay. And that's almost certainly to do with the fact that practices are partner-led independent contractors rather than direct employees of the NHS. But going back to those regulations, the government statement is basically just a rehash of what the regulations say. They're going to consult the BMA GP committee, they're going to talk to other people, relevant people too, patient groups, other GP organisations and so on. And as far as I understand it, they often do that anyway. So what's the big deal? The key here, like you said, is the kind of emphasis on the word consult. So even if consult is all the government is legally obliged to do, normally it would engage in negotiations, multiple rounds of talks over changes to the contract each year. And what GPs have said to me is that they see the government statement as a strong indicator that they may well just meet with the BMA GP committee once, present them with what they plan to do with the contract, and then send them on their way effectively. So the committee could have no more input to shaping the contract than some of the other groups the government may consult, patient groups, other GP groups and so on. And if that's the case, it won't be an agreed contract, it'll be an imposed one.
Yeah, definitely, because in the past, you think of contract negotiations as a bit of give and take, isn't there? Both sides come to the table with, this is what we want from this year's contract. The government might say, we want you to do that. The BMA might say, well, no, we don't want to do that, or we will do that if you give us that. So there's a bit more potential give and take, but that's not really been the case in recent years anyway, has it? Contract impositions are nothing new in general practice. It's been a feature of the GP contract, apart from this year's deal, over the last sort of 4 or 5 years. Although obviously the profession is now in dispute with the government over this year's contract as well, following the online consultation of changes. 2026-27 is going to be a pretty significant year for the NHS, with new contracts coming out that could govern how neighbourhoods work, some foundation trusts working towards becoming integrated health organisations. What are some of the fears about what all of this means for the GP contract next year?
This year's contract was actually the first in several years that hadn't been imposed by the government. The hope was that it marked a real turning point in the relationship between GPs and the government. Like you said, GPs are now in dispute over that contract, and I think GP leaders have actually said that given the dispute, the 2025-26 deal should probably also be considered an imposition now. So absolutely, imposition is nothing new. What might be new, though, is the level of involvement BMA GP leaders have in shaping what comes in 2026-27, if they really are frozen out of talks almost completely. But I think another factor here is that all of this comes at a time when the government's proposing these really big shifts in how general practice should work and interact with the wider NHS. The government has said it supports the partnership model of general practice, but the 10-year health plan also talked about neighbourhood contracts as an alternative to the existing model of general practice. I wrote a story just recently about concerns that enhanced services funding could be stripped out of practice level funding and moved into neighbourhood contracts. We talked about that briefly on the last news podcast a couple of weeks ago. If that sort of really fundamental change is happening or being discussed, something that would take away a really substantial proportion of the funding that practices rely on, if that's being discussed by the people who determine what next year's GP contract will look like, and the BMA GP committee isn't at the table, that could be a real concern. It's also worth saying here that, of course, even if the BMA GP committee was at the table, there's no guarantee at all that they could influence what the government would decide to do, because, as we've talked about recently, the government really isn't listening to GPs, and that's it's a big part of what's led to this dispute in the first place. But in any case, not being round the table to at least try to influence the direction of travel, it does seem like a big risk at a time when, like you said, these neighbourhood contracts are taking shape. The government's reviewing the Carhill formula that determines how core funding for general practice is distributed. And there's also these wider changes to the NHS architecture that are afoot, such as the potential creation of integrated health organisations, which could see hospital trusts take control of health budgets for entire regions of England. So if all of those things potentially have some kind of play into the fringes of what happens to the GP contract, and GPs don't have a voice around the table, or not the BMA GP committee voice, that could be a concern.
It feels like relationships between the BMA and the government are at an all-time low. It all started so promisingly back in July when the government came to power. It seems almost baffling that things have gone so wrong under a Labour government that supposedly has the NHS at the heart of its policies. And this week we saw Health and Social Care Secretary Wes Streeting write directly to GPs, being highly critical of the BMA's approach. So what's gone wrong?
Whether it's an all-time low for BMA government relations, I'm not sure. I'm long in the tooth, but maybe not that long in the tooth. The dispute really hasn't shown any signs of thawing, in recent months. Just as we were about to record the podcast, like you say, the Health and Social Care Secretary, Wes Streeting, wrote to GPs directly, and in that letter he accused the BMA GP committee chair, Dr. Katie Bramall, of behaving in a deeply unprofessional way over words that she used in a recent speech at the England LMC's conference at the start of this month. We talked about it before, but she accused the government of lying, betraying the profession, gaslighting GPs. And Wes Streeting's letter throws similar stuff back. It's all kind of playground. He accused the BMA GP chair of this deeply unprofessional behaviour. The comments in the speech suggested the BMA's lying about events that led to the current dispute. That sort of, they said this, is what has characterised this dispute from the outset, that neither side seems to be able to agree on what the actual facts behind the dispute are. So there's a real standoff, and it's hard to see where it goes from here. Will it be industrial action from GPs? Is that the outcome? Or will someone back down? Is there a way to find some kind of common ground? Ultimately, I think the root of all of this is funding. Registrars have been on strike because the government hasn't been willing or able to move towards pay restoration in the way that they want. And similarly, with general practice, the government's talked about big investment, but a lot of the new money that's gone in through this year's GP contract has been balanced out by massive increases in costs. We're talking about minimum wage rises, employer national insurance costs, and there isn't the kind of commitment that BMA wants to reversing long-term erosion of doctors' pay. I think another thing that Katie Bramwell said at the last LMC's conference was that she didn't see really any prospect of transformational investment, the kind of thing that they feel is absolutely necessary to underpin the big new contract that the BMA and the government said they were committed to sort of developing by the end of the current parliament. Pay, that willingness to sort of unpick 15 years of pay erosion was a big sticking point with the last government, and ultimately not a lot has changed with the current administration. Plus, the current government has put forward huge ideas about NHS reform without a lot of detail about how it's going to work. And that cocktail of, these slightly opaque reform plans, plus funding still being really tight, has just stretched the relationship between doctors and the government to breaking point.
Related to all of this, obviously, the BMA published findings of a poll of over 1,000 practices in which most said that the changes to online access under this year's GP contract, which, as we all know, require practices to keep online consultation systems turned on throughout core hours, most of those practices said that this change had negatively impacted patient safety. That headline figure is not really surprising given what we've been talking about on the podcast in recent weeks. But what exactly did the survey find? Why were practices so concerned about patient safety?
This goes right to the heart of the dispute between GPs and the government again. From the 1st of October, practices have been required to keep online consultation systems on throughout core hours. And the BMA said that this was pushed through without safeguards they wanted to keep patients safe and protect practices from a massive rise in workload. The government, meanwhile, said it had no idea what GPs were worried about. The whole thing was a phony war. Those were the words of the Primary Care Minister, Stephen Kinnock, and it had all been concocted by the BMA, basically. So the BMA carried out this survey of GP practices to find out about the impact of change, find out what practices on the ground actually say about the impact that this online consultation system requirement taking effect had actually had. And I think it's fair to say that basically all of the BMA's concerns have been borne out in this survey. More than 1,000 practices took part. 55% said the change had negatively affected patient care. Practices reported patients using these systems, which are meant to be for non-urgent cases or queries only, to ask about really serious concerns that they should be going to A&E for. So practice fears that, because there's no mechanism to actually stop urgent queries coming through, they would come through, and that practice would have to be super alert to sort of pick up those cases, and that all adds to the kind of workload and the stress involved. Those concerns have been shown to be valid. 42% of practices said they'd been forced to reduce face-to-face appointments to manage extra workload from online consultations. I think Kimberley wrote about that before this survey, possibly in the run-up to the change taking effect as a concern that the BMA was raising. 74% of practices said their workload increased. 68% reported increased stress. 54% said their working hours had increased. So the impact is clear and it's really significant.
And what's the BMA GP committee said about all of this?
I guess the message is basically, told you so. They said this showed that the government needs to listen to GPs and work with GPs so that when changes like this are implemented, they're done in a safe way and a sustainable way, one that doesn't clobber general practice with a huge additional workload and potentially put patients at risk.
So you put those findings to the government as well. What did it have to say?
I thought that the government response was a bit baffling. Anyway, it was interesting. If you put survey results to a government press office, as a journalist, it's not uncommon for them to be quite dismissive. They'll say your survey isn't a representative sample or something like, we don't need to really respond to this because it's not a big deal. You haven't really got very many responses. And, I guess sometimes smaller survey, maybe that's fair. But here, we've got a BMA survey with responses. It's actually from 1,300 GP practices in England. So that's something like 22% of all practices in the country. And the government response was that the findings represent a small minority of GP practices and that the survey isn't reflective of the national picture. There's a pretty staggering number of practices to just dismiss out of hand. Government comment said, this is the 21st century, patients want this. And they said, the quote was that they'd worked collaboratively with the sector to successfully roll this out at practices across the country. I mean, I think a lot of respondents to this survey would probably beg to differ. So, and also, if this is working collaboratively, what would working not collaboratively look like?
Moving on, let's talk about the budget. We're talking just after the budget has happened, so this is only a first reaction to what Chancellor Rachel Reeves had to say. So, Nick, ahead of the actual budget, the day before, there was an announcement about new funding to build neighbourhood health centres and extra money for rolling out new technology. What do we know about this? What details do we have on this so far?
About 24 hours before the budget announcement, the government confirmed it would be going ahead with plans to roll out neighbourhood health centres. It said 250 neighbourhood health centres over the sort of next decade. And it confirmed that it would go ahead with plans to use public-private partnership funding to pay for some of this. There are some updates on the numbers and the detail in this latest announcement. The government said earlier this year that there could be up to 300 neighbourhood health centres by the end of the 10-year health plan cycle. But the number they put in the budget was 250. Wes Streeting said previously that up to 50 of these centres could be operational by the end of the current Parliament, so that would be 2029. And the latest statement said 120 neighbourhood health centres would be operational by 2030, so that's just beyond the end of the current Parliament. The government release refers to new neighbourhood health centres, but the programme is about refurbishing and redeveloping some of these existing sites, or some existing sites too. In some cases, it's a bit of a stretch to claim that these places are going to be new. I think we have one sort of example I'd use. One of the existing sites that's mentioned in a government press release about all of this was a place called the Alfred Barrow Health Centre in Barrow-in-Furness. So if you look that up online, you'll find that it opened in 2019 and it's described as offering a broad range of services under one roof, which is kind of the description they use of a neighbourhood health centre. So it sounds a lot like one, and it's been around for just over half a decade rather than being brand new. The government said earlier in the year that it was exploring the idea of public-private partnership funding for these centres, basically rehashing the way governments in the past have attracted part private funding through PFI schemes to build hospitals, or schemes like LIFT to bring in third-party developers to construct new primary care premises. And we now know that there will definitely be some of this part private funding for neighbourhood health centres, possibly not all, because the government says there's going to be a mix of these schemes. Some of them will be public funded, some will be public private. But I mean, as we've alluded to a minute ago, the government doesn't feel like it's swimming in resources. So this is a way that it feels it can attract new money into the health sector to sort of speed up development in a way that if it was just funding this out of the Treasury's coffers directly, it wouldn't be able to do.
The other bit of new money that will be coming is that £300 million for technology, and the Chancellor said that this technology will be rolled out to help boost productivity. The kind of implications of that probably are around like addressing the admin burden on clinicians to free up time for people to spend more time with patients. But obviously it's not clear at all, whether any of that money, how much of that money, if any, will be coming to primary care. So the other big change, obviously, that will affect practices, Nick, is the minimum wage rise. That will have an impact on practice costs, won't it?
The minimum wage will rise by 4.1% from April 2026. And that is likely to be a big driver of increased costs for general practice. So there are a couple of things to bear in mind here that I think it's worth going over just in terms of how this will affect practices. First, the government's proposed a 2.5% pay increase for NHS staff from April in its evidence to pay review bodies. So if practices are funded for that, and then the minimum wage goes up by 4.1%, there could be a big shortfall between those two. Practices, may not be getting the kind of money they need to implement a 4.1% uplift for some of their staff. The second thing to bear in mind is what this means for staff retention. One LMC secretary told me this week that the rise in the minimum wage will bring it almost in line with Band 3 on the NHS Agenda for Change pay scale. And his view was that if people are weighing up whether they'd rather work in a potentially stressful environment facing sometimes angry patients in a GP practice versus a job in a coffee shop or a supermarket or some other local employer for virtually the same income, they may well consider jumping ship from general practice into one of those sorts of roles. And then finally, the government talks a lot about having put £1.1 billion into the GP contract this year. But GPs have pointed out that the huge proportion of this has been consumed by rising costs. Part of that is the employer national insurance contributions, but part of it is also the minimum wage increases. So we know staff are the biggest cost that practices have, as is the case for many businesses. It's not just what they mean in terms of the rise that practices would have to pass on to staff who are actually on the minimum wage. There's also potentially a cascading effect on what you need to offer other staff within your practice to maintain reasonable pay differentials so that different people aren't unsettled by the changes to one particular staff group. So the minimum wage is going up 4.1% from April next year. It went up 6.7% this year and by about 10% in each of the previous 2 years. So if the lowest paid staff in GP practices are seeing pay increase at that level, and many GP partners would say they absolutely think it's a good thing. It's necessary that the minimum wage is rising. The point is, pay for the people supervising staff on that level within practices, who themselves are probably not on the minimum wage, also needs to go up to maintain a differential. Otherwise, you get to the point where the staff on the minimum wage are being paid virtually the same as the managers who are supposed to be paid more, because of their seniority. And the point is, practices simply aren't being funded at a level to deliver those pay rises right up through their staff. So either they do, and GP partners take a hit, and we see partners reducing their drawings to cover those extra costs, or they don't, and then staff are unhappy and potentially they leave. So this is something that needs addressing when it comes to the contract for next year.
And as we've discussed, the contract for next year could be quite tricky. But what have accountants and GP representatives had to say about all of this? What's the general consensus about what the budget means for GPs and general practice?
The Association of Independent Specialist Medical Accountants, AISMA, said the budget announcements could have been a lot worse for general practice, but that they wouldn't do much to cheer up GP partners ultimately. Andy Powell, an accountant who advises AISMA, said the good news for GPs is that some of the changes to pension tax, for example, that people thought might happen in this budget haven't materialised. So, that's a good thing. Some of the fears have not come true. But things like the freeze on income tax thresholds announced by the Chancellor, so it's a further 3-year extension of income tax thresholds being kept where they are now up until about 2031, I think it is. Those are quite a big deal. Pay generally grows over time in cash terms, and if those thresholds are frozen, each year you pay more tax. Another factor is that for people who go over the £100,000 income threshold too, that means you're tax-free personal allowance, the amount up to £12,500 or whatever it is, where you don't pay any tax on your income, that starts to be eroded. And since that threshold hasn't changed, each year more and more people are likely to go over that just by virtue of inflation, effectively. They also mentioned factors like a dividend tax. AISMA said a rising number of GPs are taking dividends from limited companies, so GPs earning through companies could pay more. And ultimately, for older GPs in particular, the warning from accountants is that if the budget puts further pressure on them as partners in practice, or just as people staying in general practice, then ultimately some might choose not to carry on or to reduce their working hours.
Before we move on, we thought it would be just good to mention a story that Kimberley has written recently, which was an interview with Lancashire-based GP Dr. Shahana Moitra, who has recently undertaken 3 humanitarian trips to work as a doctor in Gaza. So Kimberley, first of all, how did you come across Dr. Moitra?
Well, do you remember a while ago we covered a story about patients and staff who had successfully campaigned and stopped Widnell Health Centre's contract from changing hands?
Yes, I do. We covered that quite at length, didn't we? The whole campaign to save the practice.
Yeah, exactly. Well, the lead campaigner contacted me to let me know that Dr. Moitra, who works as a locum GP there, has recently volunteered in Gaza with UK Med, and that's a charity that ensures countries have access to healthcare if they have been hit by natural disasters or wars.
So you spoke to her recently. What did she tell you about what she was doing out in Gaza and what her experiences were like? Was she effectively working as a GP or was she doing more emergency type medicine?
For her 3 visits, each lasting 7 weeks, she was mainly doing GP work. On her first visit in April 2024, she was part of a team who set up a primary care facility in just 2 days. And very quickly, the centre started seeing 300 patients a day. Dr. Moitra and the other 44 healthcare professionals that included nurses and pharmacists often saw people with skin infections, respiratory infections, and even some shrapnel wounds.
She must have noticed quite a lot of change over each of the times she went there.
Yeah, she has. On her second visit in March 2025, the clinical team had to start rationing medication because convoys had been prevented from entering the country. But she said that what she saw on her third visit in August 2025 was even worse. This time round, there was even less medication and staff had to decide who to prioritise who would receive it. They were seeing patients who had developed symptoms from their living conditions, and because of the poverty, the displacement, and not having clean water, patients were getting repeated infections and there was malnutrition as well. There were 2 really harrowing stories that stood out to me when I spoke to Dr. Moitra. She told me that one woman broke down and screamed at her saying, "I have nothing. I have no place to live, no tent, no money, no food," and then asked, "Why isn't the world doing more?" Dr. Moitra also spoke about the time when a family who had fled from the north after a mass evacuation order brought in their 6-month-old baby girl in for help, but she was dead on arrival. The baby had died from gastroenteritis, which, under normal circumstances is preventable. By the time the family had arrived, it was too late to do anything. By the time Dr. Moitra was leaving Gaza, the clinic was seeing up to 500 patients a day. And on top of all this, she'd seen that her Palestinian colleagues had lost weight. When we spoke, she also painted a really vivid image of her trip back in April 2024. She said that even amongst the bombing and the smoke, children were still flying kites in the sky, often made out of plastic bags. But on her third trip, she didn't see any kites being flown. What she did see was children fetching water instead of being in school, and the roads full of displaced families. Now, while Dr. Moitra's main role was to work in primary care, she did spend one day at Nasser Hospital and saw patients with wounds all over their bodies. She said that she'd never seen injuries like this in her 25 years in medicine. Dr. Moitra does plan to go back to Gaza next year with UK Med to support her international and Palestinian colleagues. She said that every time she leaves Gaza, she feels both sad and hopeful. Sad because of what the people have lost due to the war, but hopeful that one day they will reclaim their lives back. When we spoke, it really came across as to how in awe Dr. Moitra was of her Palestinian colleagues for the work they have been doing. She said that once you've witnessed that resilience and hardship, you just want to go back and stand with them.
Yeah, it's definitely worth people reading that article if they get a chance. We'll put a link to that in the notes for this episode, and it is outside of any of our login pages and paywall, so please do read that. Before we go, we've just got time for our good news story this week, which is about a practice in Monmouthshire in Wales that was affected by the recent floods, which may not sound like good news, but it sort of is. What happened here, Kimberley?
Castlegate Medical Practice was one of the many businesses in the town that flooded after falling victim to Storm Claudia. Now, it's definitely not the flooding that we're saying is good news, but rather the way the community rallied round and has helped the practice since. So since its closure, some appointments have been moved to its Raglan branch, and a neighbouring practice, Dixon Road Surgery, and the community hospital, Monovale Health and Social Care Facility, have both stepped in to offer space for Castlegate to carry out appointments. Patients have taken to Facebook and offered to help with the clean-up, and some have even taken in treats to the staff while the clean-up operation begins. In fact, many patients also took to Facebook to praise the practice staff for their swift response in moving appointments to other locations and the speed at which patients were told. So we don't have any specific date as to when the practice will reopen, but the health board said it is likely to be closed until at least the new year.
It was really badly affected, isn't it? We've got some pictures on the story you wrote about this, Kimberley, on our website, and it looks like it is going to be a bit of a monumental effort for them to clean it up, but really lovely to hear that everybody in the local community rallied round to support them. Well, that's it for this week. Thanks so much for listening, and thanks again to Nick and Kimberley. I'll be back next week, so please do join me then. In the meantime, don't forget you can keep up to date with all the latest news and access lots of other resources on our website at GPonline.com.